What's up, movers? This is Dr. Wayne Hubert. Today we are here with Jordan Wheeler. Jordan, tell me a little bit about yourself.
I am a former IFBB pro, online personal trainer, and Orange Theory fitness coach.
Excellent. So today we're going to look at a couple of different functional movements and issues that he's kind of having. And so Jordan, tell me about what's going on.
So I've got a lot of issues going on, but
Don't we all?
Yeah, right. The one that mainly concerns me is my hip.
Okay.
Like from squatting heavy, the past years,
Yeah.
and now I don't squat more than like 225, maybe 265 on a good day. Used to squat like 405, but it's one of those things like my hips from doing so much of that vertical movement, not much.
And where's your specific limitation? Is it on the down? Is it the strength coming up?
Yeah, I would say it's coming out of the bottom.
Coming out of the bottom, so you're losing that bottom end.
Yeah, so it's just like my hips they're so tight, I can't really focus on driving my knees out.
Yeah, and so rather than compensating and bailing out and producing other injuries, you're kind of backing off on the squat instead. Yeah, that makes sense. That makes sense. So what we're going to do is just a quick basic assessment of his overall range of motion, and then develop some strategies utilizing the remove power bands to improve that range of motion, decrease that pain, hopefully get you back into a little more squatting. So yeah, let's just see what we got. Wow. Is there a change?
Yeah.
Yeah. Good.
I'm not gonna lie, I was a bit skeptical. Like, how can just like 5 minutes? Like, really? Yeah.
Yeah. And this has been dealing.
That is
for
crazy.
how long?
Oh, a couple years now.
Couple years.
If you're a bodybuilder, powerlifter, or you're just in the gym a lot, like 5 minutes of just doing that, like that's almost a must on leg day. Like that is just insane.
Great. Wow. That's awesome.
Wow. Thank you.
All right. Basic range of motion, all 3 planes of range of motion. So if I can have you put your hands under your hips, I'm just going to kind of extend back over your hips. See the type of range of motion you got there. Okay. You feeling that hip at all?
A little bit.
A little bit. Okay, come back to
lower
me.
back too.
A little bit. Yeah, for sure. Now bend down and touch your toes. Do the best you can here. Good, you actually do that extremely well, even though your right hip is just slightly low. Go ahead and come back up again.
You can tell it, huh?
Yeah, you can see that.
Yeah.
So open up the hips for me a little bit. So a little bit wider here, hands under your hips. We're gonna see how much abduction you have in your hips. So just take your hips and kind of shift them to the side. And note the limitation, restrictions, symptoms, just feeling it right through there. Come back to neutral. Let's check that to the other side. You got a little cleaner, easier range of motion here.
Yeah.
And it's still gonna get a little stiff, just a little cleaner.
I can still feel it, but like coming back this way, like I can't.
Can't get through that end range.
Nope.
Yeah, okay. Come back to neutral. Now we're gonna put our feet underneath our hips. Pick up your left heel. I want you to rotate your hips towards the right. Just kind of note whatever symptom you're experiencing in the range of motion. I mean, I'm gonna give you about 55 degrees here. Come back to neutral. Switch that up. We're gonna go to the left.
Yeah, it's just so much easier.
So much easier, so cleaner. Yep. Okay, good. Last thing we're gonna do is we're gonna see how deep you can get in that squat. Okay. So with caution, I want you to get in a normal squat stance, and then just kind of come on down to the squat position and stop where you start feeling that limitation.
Where to start feeling it?
Yeah.
I have to go down again.
Yeah, sure.
Right there.
Start feeling it right about there. Okay, we're gonna come back up again. Now we're going to show a couple simple strategies that he can utilize to open up the hips a little bit more so that we can put the physiological stressors and disperse them throughout the kinetic chain versus having it isolate in that anterior hip. All right, so Jordan, what I'm picking up here is a lot of hip flexor tightness on the left, but you actually have the opposite on the other side. So your right glute is much tighter than the left, and that's why you're having that limitation of range of motion when you go to the right compared to going to the left, which is technically your symptomatic side. So we're going to develop a couple strategies here. So we're going to grab a lacrosse ball. So we're going to use this lacrosse ball right on that gluteal region. So we're going to take the lacrosse ball and set it right on that spot. Okay. Now I want you to pin that lacrosse ball between the glute and the wall, just kind of like this. Okay. Sink into it. I got most of my weight on my left foot here and just driving into there. Once you get here, go up and down a little bit on sagittal plane. Then you go forward and back in that frontal plane, and then little circles for that transverse plane. Let's have you give that a shot. Just right in that right glute. So set it on your glute first. And then just kind of lean into that wall. Bring that right arm out in front of you. Okay, so most of your weight's gonna be sitting right here. Keep this one relaxed. Find that hot spot. You got it?
Yep.
Okay, now just gonna go up and down a little bit in that sagittal plane, like 7, 10 reps. But use your whole body to do that versus shifting your hips.
Okay.
There you go. Yeah, it's brutal, isn't it?
Yeah.
So we want to get work done, but we don't want to traumatize it either. Okay, now just go forward and back a little bit with your body. There you go. Like I said, don't over-traumatize this, but get some good work done. Good. Now your last plane of range of motion is that transverse plane. Just so do a little bit of circle. Perfect. And all that movement's coming out of the dynamic of this side, and that one's staying just kind of limp. Excellent. All right. So of course we can do that on both sides, but right now Jordan's got his main issue on that right hip flexor, or right glute. So the next step, what we're going to do is we're going to use the power band, the remove power band, and show you how to open up that left hip.
Okay.
So we're going to put the foot into the band. We're going to hike that up high. We're going to do a variety of different lunges here. So we're going to do a frontal plane lunge. We're going to turn 45 degrees, and we're going to sit back on it to get that semi-membranosus, or that medial hamstring. We're going to turn 45 degrees again. We'll get that semi-tendinosus. We're going to turn one more time to get that biceps femoris, and then we'll wrap all the way around and distract, get some long axis distraction of that pelvis or that femur in this position, forward and back, side to side, and then a little bit of internal and external rotation of that hip. Okay?
Got it.
So let's get you into that.
Let's see here.
There you go. And get it high up. Try to get it right on that skin.
Good.
So in that position, we just want to kind of drive that hip to the right and open up that left
How
abdomen.
wide do I want my feet here?
About there. About there is good. It's a pretty good tension on the adductor. Need more tension?
Do I need further up?
Might need to be a little bit further out. There you go. Feeling that open up that medial hip, correct?
Yeah.
Inside thigh?
Yeah.
Okay. No pain, just a stretch.
Yeah.
Okay, so let's do about 3, 4 more of them. Good. Now we're going to take your right foot and turn it towards me about 45 degrees. A little bit more. There we go. From here, we're going to sit straight back on it like this. Yeah, perfect. Get that up high. It works best right on the skin, so we use that tacky texture of the band. Keep rocking
Do I
back.
want to keep my legs straight?
Yeah.
Okay.
Yeah, you're doing great.
And the back stays flat.
Back completely stays flat. Yeah. Yeah.
It's kind of like a stiff leg then.
Exactly. Exactly. So now we're going to turn 45 degrees so you're perpendicular to the band.
Okay.
We'll do that same thing. We're just going to single toe tap bounce on that right and just sit back on it
Okay.
like a straight leg raise. There you go. Good. Now you'll feel more of the middle hamstring,
Yeah, right.
middle of the thigh. Good. Make sure you're using the hip hinge, not spine movement. One more. Great job. Okay, now we're going to take that right foot, we'll rotate another 45 degrees.
Okay.
We'll do that exact same thing. You might want to tension up the band a little bit more. And then from here, we're going to sit straight back on it again. Good hip hinge. So right here, just come back like this. Stick the butt straight out, back up again.
It kind of forces you to like stabilize like in different directions.
Yeah, exactly.
I can definitely feel it's more on like that outer edge.
That's exactly where it should be, that
Yeah.
outside
Yeah.
hamstring or that bicep femoris. Great job. Also, the band kind of helps you, forces you to engage your core a little bit as well.
Yeah.
Control that movement.
I'm not falling over.
Yeah, we don't want to fall over. Let's go one more, Jordan. Great job. Okay, now we'll spin opposite, go all the way around, back to being parallel. Keep that band up high, put some tension to it, and then we're going to go in that quadruped position.
Okay.
Okay, so try to relax your left leg as much as you can. You're gonna put most of your weight on your right. So for this one, we're just gonna lean forward and back, your knees just chilling. Just forward and back, and let that band kind of distract that femur out of its acetabular joint. Good. Now we just do a little bit of side to side. Just shift your hips from one side to the other. Good. Let's go one more. And the last one, we're going to do internal rotation and external rotation of the knee. So you use your left knee as the driver and just kind of spinning on your toe. Engage a little bit more core here. There you go. Just let this hang.
Okay.
There you go.
Oh, gotta engage the core.
Gotta engage that core. Center of life. Great job. Okay, let's have you come back up again. We'll get this out. Okay, so now we're gonna take you through that same range of motion again. So we'll set up, hands on our hips, and go backwards over our hands. Well, one, your range of motion's better. How you feeling?
Pretty decent.
Yeah, better than what it was before. Yeah? How about bending down and touching your toes? Good.
Yeah.
And now your pelvis is actually leveled out. Go ahead and come back up again. Open up the hips a bit. So we check that frontal plane again. Hands on your hips and go to the side. That's opening, buddy.
That is crazy.
Come back to
That is
neutral.
crazy.
And then go this way here. Great job. Now we also got to check that rotation. So we bring our feet back underneath our hips. Pick up your left heel and rotate to the right. Much better range. Much better range.
Yeah.
Come back to neutral. Switch up the other side. And go this way. Great job. Now the real testament. We did all of this to improve your squat, right? Mm-hmm. Okay. So get our feet back in the same position that we had before.
Okay.
And let's just see what we got. Wow. Is there a change?
Yeah.
Yeah. Good.
I'm not gonna lie, I was a bit skeptical. Like, how can just like 5 minutes? Like,
Yeah.
really? Yeah.
Yeah. And this has been dealing. You've been dealing with
that
this
is
for
crazy.
how long?
Oh, a couple years now.
2 years. So just by utilizing some simple strategies that you can be doing every day on your own,
Yeah.
keeps you, one, out of clinics like mine, but two, makes you function.
Well, that's
feel-
like, I mean, if you're a bodybuilder, powerlifter, or you're just in the gym a lot, like 5 minutes of just doing that, like that's almost a must
Yeah.
on leg day. Like that is just insane.
Great. Well,
Like,
that's awesome.
wow, thank you.
All right. Well, there you have it, guys. We took you through a quick assessment, a range of motion of a particular problem. We developed a strategy for it so that you can be utilizing the removed products with the lacrosse ball and the power band to hopefully get you to move better, function better, make you feel better. Get out there and remove today.